A recent study found suicidal attempts or thoughts in children and teens has doubled between 2007 and 2015. The CDC says 300 emergency rooms were tracked for children between the ages of just 5 and 18 years old. KCTV5's Amy Anderson found those numbers are skyrocketing here in Kansas City as well.
There was something there.
Nathan and Sylvia Harrell and BJ Thomas know the pain of losing a child to suicide all too well. Chad Harrell was a happy-go-lucky 17-year-old heading into his senior year at Blue Valley North High School. Reagan Johnson was a 16-year-old at Paola High School. She loved her friends and she loved to race four-wheelers. Both of these beautiful young lives ended over what their parents are convinced was a snap, impulsive decision.
There was not a single person who knew that Reagan was struggling that day. Not one. She didn't text anyone. She didn't call anyone.
Chad was upset, though it was for a very routine teenage reason. His parents told him he couldn't go to a party and took his phone. He'd spent the evening in his room. His mom and dad both went up to talk to him before bed.
I told him I loved him. He wasn't in a really good mood, so I didn't get anything back. And that's the last time I spoke to him.
I decided to just go in and check on him because, it wasn't unusual for him to still be up in his room or whatever, just to make sure that he was calmed down, and I found him.
A recent report showed the number of young children thinking about or attempting suicide has doubled nationwide. Dr. Shayla Sullivan is a child psychiatrist at Children's Mercy and says they're seeing those rates here in the metro as well. The hospital now routinely screens all children for suicidal risk, beginning at age 12. Doctors and nurses use a standardized screening test that helps identify children who are struggling.
But really it helps to identify kids that feel like they're a burden, kids that have thoughts about wishing they weren't alive, kids that have actually attempted suicide. Those are some of the things we know that are predictive of someone who has elevated risk and may actually try to end their lives.
Dr. Sullivan says early intervention works, and though Chad's parents say he always seemed carefree and happy, they say after he passed away, they did find a diary he'd written in middle school that may have provided a clue that he was struggling.
He had a bunch of things about the girl he liked then, and the last line in there was, "and no more thoughts of suicide," in 7th grade.
The teens' parents all say it's time for us to start talking about it openly, to let kids know they may feel desperate from time to time, but that there is help and to ask for it.
We can't sweep it under the rug anymore, because clearly whatever we've done in the past has not worked. If the epidemic is escalating, and I believe that it is, we've got to do something about it.
In Kansas City, Missouri, Amy Anderson, KCTV5 News.
So sad. If you or someone that you know is dealing with any of these feelings, the National Suicide Prevention Hotline is on your screen right now. That number is 1-800-273-TALK.